Contamination OCD. Contamination OCD centers around an intense fear of germs, dirt, or illness. Individuals with this form of OCD often believe they or their environment are contaminated, even if there is no real risk. This leads to compulsive behaviors aimed at reducing or preventing contamination. The most common example is excessive hand washing, sometimes lasting for long periods or done many times in a row. Others may avoid public places or objects they believe to be dirty. Cleaning rituals are also common, where surfaces are wiped repeatedly. Importantly, these behaviors are driven by anxiety and the need to feel safe, rather than hygiene concerns alone. The compulsions provide temporary relief but don't address the underlying fear, which can disrupt daily life significantly. Checking OCD involves repetitive behaviors aimed at preventing harm or mistakes. People with this type of OCD might repeatedly check that doors are locked, appliances are turned off, or that they haven't caused an accident. The checking is usually driven by intrusive doubts or fears that something terrible might happen if the action isn't confirmed. For example, someone may leave their house but turn back multiple times to verify the stove is off. These rituals can be time-consuming and distressing, and even after multiple checks, the anxiety often persists. Checking OCD is not about forgetfulness, but a compulsion to reduce uncertainty and prevent imagined catastrophes. Symmetry OCD. Symmetry OCD is characterized by an overwhelming need for things to just feel right. This often means arranging objects so they are perfectly symmetrical, aligned, or ordered. The discomfort from disorder or asymmetry can cause significant distress, leading to repetitive straightening or rearranging of items. For some, it extends beyond physical objects to mental order, such as thinking or speaking in a certain way. The compulsion is motivated by a desire to achieve balance or harmony, often accompanied by a feeling that something bad will happen if things are out of place. Religious OCD. Religious OCD involves obsessive concerns about morality, religion, or the fear of sinning. People with this type of OCD may experience persistent worries that they have committed a sin or are morally flawed, even when there is no evidence. This often leads to compulsive behaviors such as excessive praying, repeated confession, or mental rituals intended to neutralize sinful thoughts. These compulsions are attempts to reduce guilt or anxiety related to perceived moral failings. Religious OCD can impact various religious practices and can lead to a heightened sense of fear around spiritual or ethical issues. Importantly, these obsessions are not a reflection of true beliefs, but rather intrusive thoughts that can cause significant distress. Harm OCD. Harm OCD involves persistent, intrusive thoughts or fears about causing harm to oneself or others. These thoughts are unwanted and distressing, and they often contradict the person's values or intentions. Common obsessions might include fears of stabbing someone, pushing someone into traffic, or harming a loved one in some way. Despite the violent content of these thoughts, individuals with harm OCD are not dangerous. In fact, they often go to great lengths to avoid triggering situations, such as hiding sharp objects or avoiding being alone with others. This is to ensure they don't act on the thoughts, even though they have no actual desire to. Harm OCD is frequently misunderstood, but it's a well-documented and treatable form of obsessive-compulsive disorder. Sexual orientation OCD, often called HOCD, involves intrusive doubts and obsessive questioning about one's sexual orientation. People with HOCD may repeatedly question whether they are gay, straight, bisexual, or otherwise, despite no real change or attraction prompting these doubts. These obsessions can cause intense anxiety, confusion, and distress. To manage this, individuals may seek reassurance, mentally analyze their feelings, or avoid situations that trigger these doubts.